Hi, I'm Gus, the esophagus. I'm here because I've heard that you have eosinophilic esophagitis. I bet you've never even heard of eosinophilic esophagitis until today. Well, I have it too, and I call it EoE because that's way easier. When I found out that I had EoE, I was pretty scared. But learning more about EoE and how to take care of myself made it a lot easier. You may be wondering, what is an esophagus anyway? I am the stretchy tube inside of you that goes from the back of your throat to your stomach. My job is to send food down to your tummy. Now that you know what an esophagus is and what it does in your body, I would like to introduce you to my friend, Dr. Werschel from Chicago, to explain more about EoE.
Hi, I'm Dr. Barry Werschel. I'm the chief of the Division of Pediatric Gastroenterology, Hepatology, and Nutrition at Children's Memorial Hospital in Chicago. I'm also a member of our Eosinophilic Esophagitis Center, or EoE as we like to call it. Eosinophilic esophagitis is a chronic inflammatory disease of the esophagus, the tube that leads from your mouth to your stomach. It's important in moving food down into our stomachs as part of the digestive process. The eosinophil is a normal blood cell that's found that helps to fight infection. But in this disease, it infiltrates the esophagus and inflames it, causing symptoms.
Thank you for explaining what EoE is, Dr. Werschel. Can you tell us what causes it?
Causes of EoE are really unknown. And when things are unknown, everybody has a theory. What we think is probably the cause is an imbalance of the immune system. Our immune systems are very tightly regulated. They try to allow us to react to things that we should react to, like parasites and invading bacteria, but on the other hand, stop those reactions so that chronic inflammatory diseases don't occur. Something tips that balance. And what that something is really hard to identify at this time. It may be something in our food chain. It may be the cleanliness or the over-cleanliness of our environments over the last century. It may be medications. It may be things that we come in contact with on a daily basis. But what we do know is that once that balance has been tipped, and you start to manifest the symptoms and the disease, we know that this is probably a lifelong condition. Ultimately, if a good therapeutic regimen is started and we can control the disease, we can control the complications of the disease. Over the long haul, what we see is in uncontrolled disease, patients get scarring of their esophagus, and with scarring of their esophagus, it's very difficult for food to pass down. If we can diagnose the disease, start treatment, then we can prevent these kinds of complications from happening.
Dr. Werschel explained that EoE is caused when eosinophils are in your esophagus and create inflammation. Let me introduce you to my friend Phil. He is an eosinophil. He is a white blood cell. Phil's job is to attack things like parasites and fight infections in your body to keep you healthy. But he doesn't belong in your esophagus. When eosinophils get confused and are in your esophagus, they create inflammation and make you feel sick. Phil's not a bad guy. He just gets confused. And when he does, he makes us feel sick. Dr. Werschel, who gets EoE and what are the symptoms?
EoE is a disease that can occur anytime in life. We see it in young infants. We can see it in older adults. The symptoms vary depending on one's age. In younger children, the common symptoms would be vomiting, abdominal pain, loss of interest in eating. For older individuals, they have a symptom called dysphagia, which in non-medical terms means difficulty swallowing. So they have a funny sensation of food is kind of sticking on the way down. In its extreme, for some adults, they actually get food impacted, stuck in the esophagus, and that's a medical emergency needing some immediate relief. When we see those symptoms or we hear of a child having difficulty swallowing, it perks up our ears. It's a red flag that this patient may have EoE, and we start to think about it immediately.
Wow! It seems that different people might have different symptoms from EoE. Dr. Werschel, can you tell us how eosinophilic esophagitis is diagnosed?
The most reliable test we have for diagnosing EoE is something called an endoscopy. That's where we take a look down with a tube with a light and a camera, and we can look at the esophagus, the stomach, and the small intestines. Just as importantly, Through that tube, we can take small pieces of tissue to look at under the microscope and actually look for these eosinophils and count these eosinophils. Now, there are other conditions that can cause eosinophils to infiltrate the esophagus, and we want to eliminate those as a possibility. And one of the big possibilities would be acid reflux. So it's very important before you have an endoscopy that you put on some type of acid-suppressing medicine for at least a month or two prior to the endoscopy, so that if we see large numbers of eosinophils in the esophagus, we know it's not due to acid reflux, it must be EoE.
Can you tell us a little bit more about who gets EoE? Is it just kids, or can grown-ups get it too?
Most of the time we see EoE in patients who have some other type of food allergy. About 2/3 of patients will have a first-degree relative or themselves have some type of allergy, either a food allergy, eczema, asthma, or hay fever. Oftentimes we're asked, well, my one child has EoE. What's the chances that my other children are going to have EoE? And the answer that we can say is probably very small. We do see familial clustering of the disease, but it's usually less than 10% of the patients that we follow. So for most instances, it occurs in an isolated event within a family, and it's in a family or a patient who has other forms of allergies.
It seems for the people who get EoE, it could develop at any time. Well, now that we understand more about what EoE is, what problems it can cause, and how it is diagnosed, we should learn more about how to treat eosinophilic esophagitis. My friend, Dr. Ben Anav from Virginia, will tell us more about how to treat EoE.
Hi, I'm Dr. Ben Anav. I'm a pediatric gastroenterologist. I practice in Northern Virginia. Let's talk a little bit about the treatment of eosinophilic esophagitis. The decision on how you treat eosinophilic esophagitis is a collaborative effort between the patient and the physician. Allergy testing can be very helpful here because you have to decide really between a dietary change versus using medications.
Dr. Anav, can you tell us how the different treatments work for EoE?
The first option is a guided elimination diet where it's based on your allergy testing. We remove things that have come up positive on your allergy testing, whether it be blood tests, prick tests, or patch tests. The second option is a non-guided elimination of the 6 top food allergens. That's milk, soy, egg, wheat, fish, and nuts. Obviously, both of these options can be very challenging, but also very effective. Another option is an amino acid-based formula diet. Sometimes we use them as a supplement to add to our dietary elimination, and sometimes we use them solely. Fortunately, a lot of these amino acid formulas now come in different flavors as well as juice boxes. Patients who require just formula can sometimes have difficulties tolerating the volume and the amount that they have to drink throughout the course of a day. This is when a G-tube is sometimes considered. A G-tube, or a gastrostomy tube, is a tube that goes directly into the stomach, and you can give the formula through that without having to drink excessive volumes. Some patients do this throughout the course of a day and have a little backpack that carries a pump and feeds them continuously, and some patients just do this overnight.
So it sounds like there are different ways to treat EoE. Some people might go on an elimination diet where they avoid the foods that have been found to make them sick. Some people might take an elemental formula with or without food to get their nutrients. Some of those people might need a G-tube. And some people might also need to take a medicine from their doctor that helps calm the eosinophils. Dr. Enav, can you tell us more about the types of medicine for EoE?
The other option is steroid therapy. These steroids are very similar to what we use in patients with asthma. Instead of inhaling the steroids, we swallow them and it coats the esophagus. This decreases the irritation and the inflammation. These therapies have shown to be very effective. Unfortunately, one of the downsides is that we don't know the long-term consequences. So far, the data we have is encouraging and that there's very little side effects. However, one of the problems is when you come off of steroid therapy, the inflammation recurs. Sometimes we even use these in combination. Initially, we try to get the disease process under control with steroids, and then we incorporate a diet that gradually we introduce and people are able to tolerate better.
Dr. Anav, I understand that some patients might start with one treatment, like dietary therapy, and change to a different treatment, like steroid therapy. Some of my friends are on both treatments. Some switch from one to another. How do I know which treatment is best for me?
Our expectations over time when it comes to therapy for eosinophilic esophagitis is to reach a manageable point. This is a lifelong disease and it's chronic. We don't have a true cure yet, but we try to keep the disease in remission. We'll make a decision to do dietary therapy, and initially it could be very challenging, but the goal is to eventually reintroduce foods to the diet. As we do that process, repeated endoscopies are needed. Generally speaking, you need to be on a particular therapy for 2 to 3 months at a time before we know if it's healed the esophagus. And the best way that we know that is with an endoscopy. In the long run, we hope to have other tests that will give us guidance, but we're not there yet. A lot of questions come up about life expectancy and what's the long-term issues here. Generally speaking, we have no data that shows there's any shortened life expectancy. One of our greatest concerns, particularly in our pediatric population, is that we prevent stricturing disease, food impactions, and difficulties with eating and daily life. Some patients can be asymptomatic, but we know that there's ongoing inflammation, and it's still important to treat this because in the long run, we don't know where they'll end up as adults. To date, we know of no patients that have developed cancer from eosinophilic esophagitis, and we follow some adults for long periods of time who have very significant disease, and we haven't seen that. Our biggest concern revolves around strictures, difficulty eating, and general lifestyle changes that are caused by having EoE.
Thank you, Dr. Anav. It was really helpful hearing about the different treatment options for EoE. I know it sounds difficult at first, but with a positive attitude and help from your family and friends, you'll find it's not as hard as you think. My friend Daniel will explain more about what it's like to live with EoE.
I was diagnosed actually, I think in 2006, and I was 10 years old at the time. I remember the specific incident that caused my EoE to be discovered. My dad was actually telling me that I had to finish my plate of, I think it was spaghetti that I was eating at the table. And I told my dad, no, I'm not finishing the spaghetti. And he made me sit at the table till I finished the spaghetti, and I couldn't do it. So finally he asked me, what is wrong with you? Why can't you finish this? And I said, well, it hurts every time I eat. So my dad took me to a doctor, and we discovered that I had EoE. I was definitely very scared to begin with because actually originally what they discussed with me was going on an elimination diet where they didn't completely eliminate food, but they just took out the major allergens. I failed that and still had scarring in my esophagus. So then I did a diet where they did patch testing where they eliminated the foods that I seemed to react to on my skin. That still caused a problem. So we then took all food out of my diet, and I ingested all my food through a G-tube in my stomach. Getting the stomach to the G-tube, originally, we kind of discussed it as an option, like worst case scenario situation. You would have to get a hole inside your stomach, and then you'd ingest your food through that. But when I heard it the first time, I was like, oh yeah, that's not going to happen to me. I think I've had my G-tube for, I want to say 5 years. And those 5 years, I'd say probably it took 2 or 3 to become comfortable with it and really kind of understand that, it doesn't control me, but it's a part of me. I mean, it's the same as eating for anyone else. That's the way I view it. In total, I've actually only had, I think, 1 person or maybe 2 people that have ever said anything. And usually when people do say stuff or stare, it's just because they're curious. So, originally I was kind of offended, like, who would look, and like people that are like making wide eyes at you, like, why, that's, so scary or whatever. But it's usually just because people have no idea what's going on. And, when I think about it, if someone walked by me that had, like an oxygen tank or something, I'd probably look and be like, oh, I wonder what's going on there. So that's really just what people are trying to discover, like what's going on. So usually, sometimes, if people ask, I'll tell them. Other times they just, kind of look, and you just gotta accept that it's just curiosity. I really like to play soccer, and I really like playing the piano and singing. I'd say EoE has actually pushed me to become a better piano player, singer, and soccer player. Just because finding, something that I really love to be a distraction from just kind of the problems that I was going through has, fueled kind of energy for me to kind of pursue those interests. And I encourage anyone that has this disease to, go forward and find activities that they really love and stick with them. And also, stay social. If anything, it's made my relationship with my friends become almost stronger. And, they just they accept it. Just as I've learned to accept it, they've learned to accept it. So, they might be having pizza. I'll be next to them bolusing. And they, know that that's normal now. Even though people are staring at us, they're kind of, they're not fazed by it. They're like, oh, well, that's just Daniel. A big thing is you can't sweat the little things. One of the first weeks I was back in school, I was still pumping at the time, and for pumping, you have a cord that goes from your G-tube into a backpack that I was actually wearing that slowly pumped food into me. And I was walking inside the school with my mom, and my knee caught the cord, and it pulled my stomach, and then the tube disconnected and the pump disconnected. So there were two hoses that were just spraying formula all over the lobby of the school. And, my mom and I just looked at each other and just started laughing because, there's nothing you could do about it, and it happens. So you just gotta not be, upset by little things that don't matter that much.
Daniel, you are so brave. Now that I've heard your story, I know that I can still have fun, play sports, and manage my EoE. My doctor said that I need to stop eating certain foods to help me feel better. To help me with my new diet, my doctor sent me to see a dietitian, someone like Michelle Schucker, a registered dietitian at the Children's Hospital of Philadelphia. She was very helpful in teaching me and my family all about the things I can eat. Michelle, can you share more information about diet with us?
Hi, I'm Michelle Schucker, a registered dietitian and the clinical program coordinator and nutritionist in the Center for Pediatric Eosinophilic Disorders at the Children's Hospital of Philadelphia. I have been working with children with eosinophilic esophagitis for over 12 years.
When does someone with EoE need to see a dietitian?
It's very important for patients with EoE to meet with a dietitian after their specific diet is prescribed. Whether the patient will be on an elimination diet, removing one or several foods, or whether they'll receive all of their nutrition through elemental formula. But once it's determined which foods will be removed, the dietitian will then discuss with the family exactly how this will occur, how to replace certain foods with others, how to locate specific resources, and how to ensure that nutritional needs are met with diet restrictions in place.
Michelle, can you still cook and bake at home when you have food allergies?
It can be very challenging to prepare foods at home when you have multiple food allergies. But there are a lot of resources that can help with this. There's a wide variety of allergen-free products that are available these days, many more so than used to be. The commercial egg replacers, let's say, or gluten-free bread mixes or brownie mixes or cake mixes that are available. Just a lot of products out there to help with this. A lot of different cookbooks that can help you, a lot of different recipe databases, a lot of smartphone apps that can help you with this as well.
What should people with EoE look for on food labels?
Food labeling laws require manufacturers to list the major food allergens if they are contained in a product. And this applies to packaged foods sold in the United States, whether they are domestic products or whether they're imported products. What's especially important for patients with EoE to remember is that the foods that they may be avoiding might not be one of these top allergens. So it's especially important to always read labels thoroughly and also recheck labels because product ingredients can change over time.
Michelle, is it safe for people with EoE to eat out at restaurants?
Having EoE doesn't necessarily prevent you from eating in restaurants, but things will go a lot more smoothly with some preparation and communication with the restaurant staff. So prior to going to a restaurant, it can be helpful to look up their menu online, or there are a lot of smartphone apps that are available that can help you locate a restaurant that serves safe foods. We also encourage our families to have a backup plan and to bring a safe food that they know their child will eat and have that with them in the restaurant just in case. It's also a good idea to contact the restaurant a few days ahead of time and explain your situation. Odds are it's not going to be the first time that they've encountered a potential customer with a food allergy, and if it is, well, then that's just an opportunity to educate them. But it's a good idea to meet with the person who's going to be preparing your food once you get to the restaurant and review again the specific ingredients that need to be avoided, and then if possible, have the person who's prepared your food actually deliver it to you. The bottom line is that with a little preparation and communication, that it's still possible to eat in restaurants even when you have EoE.
At first, I was worried about having to avoid certain foods, but now I just make sure that I follow the ABCs of food allergies. A is for awareness. Be aware of what foods to avoid. You can do this by reading the ingredient lists on food labels. Keep a running list of foods that are safe to eat. Bring this list to the grocery store and add to it as you shop. Plan for extra time at the grocery store, but realize you will get faster at shopping as your list grows. B is for balance. Balancing everyday life and food allergies can be challenging and stressful. It is okay to feel overwhelmed at first as you are trying to make lifestyle changes. Look for resources in the community and online that can make things easier. You are not alone. C is for creativity. Challenge yourself to be creative and prepare food at home and come up with your own recipes. Start simple by using fresh foods. Usually, processed foods that come in a box or a package have more ingredients and are more likely to have something in them that you should avoid. Starting recipes from scratch may take some time and getting used to, but remember, you can prepare ahead of time and freeze certain foods for later on. D is for dietitian. Find a registered dietitian who can help you find safe foods to eat and help you recognize hidden ingredients. They can also make sure that your child is getting a balanced diet with all the nutrients they need. Check out www.eatright.org. E is for education. Educate yourself about food allergies and make sure your child learns why it is important for them to avoid certain foods. Don't be afraid to ask your healthcare professional if there is something you don't understand or want to know more about. I've learned so much from my friends, Dr. Werschel, Dr. Anav, Daniel, and registered dietitian Michelle Schucker. I hope you have too. Now I know that having EoE doesn't mean I have to miss out on much. If you would like to learn more about eosinophil-associated diseases, like eosinophilic esophagitis, visit my favorite website, www.appfed.org, the American Partnership for Eosinophilic Disorders. You may just see Phil and me there. I would really like to thank our friends at Nutricia, manufacturer of Neocate, for making this educational video possible. And a big thank you for making yummy elemental formulas for people with EoE. If you want to learn more about their products, visit Neocate's website at www.neocate.com. It was really nice meeting you. Remember to stay positive and be healthy. Bye!